Hey guys, welcome to part 2 of our mentoring minute for snapping hip, and today we'll cover more interventions. If we talk about anterior snapping hip, again related to the iliopsoas, first we can start just trying to teach that iliopsoas to kind of let go. A great way to do that is a PIR, post-isometric relaxation. So I can have Mike bend this knee, lay a little bit diagonal so this leg's off the table. Good. Now I'm stabilizing his femur as much as I can. Normally we'd have the knee bent, just so you guys can see in the video, we'll lower that down. Right? And I'm holding his leg, and I'm going to have him gently try to lift his knee up towards the ceiling, firing that iliopsoas, and then just let it go. Good. Go ahead and push up into my thumb, and breathe out, let it go. Nice and gentle, breathe in, lift up, and as he breathes out, I'll take up some slack. Again, I'm not trying to stretch the iliopsoas at this point, just having him move from flexion to extension, letting this go. We can progress to then having him do that on his own. So again, if he starts here, you're going to just kind of slide your heel out, let it go. If that's painful, right, he can't let it go without a snap or a pop, I can have him tighten his abdominals to help kind of stabilize his pelvis from above. That helps stabilize the origin of that iliopsoas. Again, just let it go. If that still is painful, there's still a snap reproduced, we can add some resistance to his foot. So in this case, I'll put a red TheraBand around his ankle and wrap it behind. Have him hold on to that. Good. Again, he'll slide his heel up, and now as he pushes down to let it go, he has to use some strengthening, some activation of hamstrings, glutes, some hip extensors to push that band down. So we get a little reciprocal inhibition of that iliopsoas, so hopefully have a decreased attention on that muscle. The progression from a slide from here would be then march it up to 90, so concentric contraction. The band actually assists with that, which is nice. And then put it down and let it go. Good. All right, up, down, let it go. Remember, we're always making sure we have an abdominal contraction here to help stabilize the pelvis from above. And again, that's for the anterior snapping hip. Okay, if we talk about the external or lateral snapping hip, so go ahead and lie on your left side. We mentioned that glute med strengthening. So again, nice, easy one that research shows has good activation of the glute med and glute max without the TFL would be sideline clamps with TheraBand. So flex the hips and knees, keep your ankles together, keep your hips rolled forward, and just lift that top knee towards the ceiling. Nice. Good. And we always want to make sure we're palpating to make sure the right muscles are working. Good. Hope you guys enjoyed today's mentoring minute on interventions for the snapping hip. Take care, guys. See you next time.